What causes PE and ED?
Is PE and ED more common in people who are inexperienced?
One cause for premature ejaculation could be if the person was inexperienced, they're very nervous.
I think perhaps there's a difference between whether people have been circumcised.
I think erectile dysfunction could be a factor if you don't fancy your partner.
Diet, perhaps, maybe it might be genetic.
Depends how good looking the broad is.
Yeah, there is some evidence, yes.
Because there's always that sort of element of nervousness and anxiety, both of which can lead to PE and ED. Perhaps the first time a man has sex, there may well be some elements of both of those conditions.
A lot of young men seem to think that excessive masturbation might lead on to premature ejaculation, or has maybe caused their premature ejaculation.
Yes, that theory isn't actually true.
Right.
And one of the ways of treating premature ejaculation is by controlled masturbation.
It does seem to be true that some people stop fancying their partners sexually, and this can lead to erectile dysfunction in a man.
Certainly in long-term relationships that is very often the case. But I think also it is important to remember, particularly as the man ages, and once he gets past the age of 40, puts on a bit of weight and has perhaps been smoking for a number of years, physical factors can come into play as well. But then there are a lot of theories regarding the psychological causes of premature ejaculation. These may relate to an adverse early sexual experience where there was a lot of pressure to get it over and done with as quickly as possible. If it was, say, in the back of the car or in the parents' home with the parents creeping around.
I think a healthy diet along with exercise for general fitness, which improves sexual health. But in terms of an aphrodisiac or a specific food, is there anything that you recommend, Tom?
No, actually, no, there isn't any evidence at all. It's right that diet can play a part in that. If you have a high-fat diet, a high cholesterol diet, and drink a lot of alcohol and you don't take care of yourself, then yes, that will contribute to erectile dysfunction.
What about, this idea of genetic problems or things being passed through families? I think there's maybe a little bit more evidence around that.
Yes, and particularly for the organic causes of ED, high cholesterol tends to run in families. If there's a history of heart disease or strokes or high blood pressure and diabetes, there's evidence that those conditions run in families and they will contribute to erectile dysfunction.